Om Dham Dhanvantare Namaha. Karpura Gauram Karunavataram Samsarasaram Bhujagendraharam Sadavasantam Hridayaravinде Bhom Bhavani Saitam Namami. Let me share. The topic is clinical indications of Amritottara kashaya, an experiential and scientific view. So kashaya preparations are very widely used in Ayurvedic practice. Among these, Mahamanjishtadi kashaya, Maharasnadi kashaya, Mahasudarshana kashaya, Amritottara kashaya, Panjarita kashaya, Patola Katarohinyadi kashaya, Patoladi kashaya. These are some of the kashaya preparations which are very commonly used in the general practice. Now let us see the clinical indications of Amritottara kashaya. So kashaya formulations are commonly used in the management of various disorders by Ayurvedic physicians in Indian subcontinent. Now Ayurveda is becoming more popular worldwide. Kashayas like Mahadittagam kashayam, Mahamanjishtadi kashaya, Maharasnadi kashaya, Tiktaya kashaya, Rasnadi kashaya, Manjishtadi kashaya, Phalatrikadi kashaya, Patoladikwata, Yavadikwata, and Patola Rohinyadi kashaya, Maha Sudarshana kashaya, and Varnadi kashayas are few of them which are usually given in clinical practice. Amritottara kashaya is one such preparation which is commonly given in the management of various types of fevers and in respiratory disorders. Its ingredients are Guduchi, Haritake, and Shunti. It is having actions like Deepana, Pachana, Jwarahara, Archinashaka, anti-infective, antibacterial, bactericidal, and expectorant also. The present paper highlights about the clinical indications of Amritottaram Kashayam in experiential and scientific view. So, Kashaya formulations are easy to prepare and administer also. They are frequently given in the management of various disorders by Ayurvedic physicians worldwide. Amritottara Kashaya is one such preparation which is effectively given in respiratory disorders and disorders associated with fever. It is bitter in taste and difficult to administer in children. So diseases like Samanya Jwara, Chikungunya, Dengue, COVID-19 infection, viral hepatitis, worm infestation, alcoholic hepatitis, rhinitis, coryza, upper respiratory tract infection, lower respiratory tract infection, chronic bronchitis, acute bronchitis, Kasa, and Tamakashasa are indicated for Amritottaram Kashayam. In the management of these disorders, Amritottara Kashaya is given with suitable disease-specific adjuvant. So ingredients of Amritottara Kashaya is Guduchi, Tinospora cordifolia, Haritaki, Terminal chabilla, and Ardhaka gingibil officinale. So this is the Guduchi, Tinospora cordifolia. It is Tiktarasayukta, it is hepatoprotective, immunomodulator, hypoglycemic, and rasayana actions. This Haritaki, Terminal chabilla, it is Virechaka, Malavatan lomana, Pancharasayukta, and it is useful in ulcers and Kasa, Shvasa, etc. This is Shunti, Ardraka, Gingiber officinalis. It is Katrasayukta, and it is having anti-allergic, antihistaminic action also, and also CNS stimulant. It is Kasa, Shvasa, Hara, Pravata, Hara. So actions of Amritottaram Kashayam are Jwarahara, Deepana, Pachana, Trimigna, Rasayana, immunomodulator, anti-infective, bactericidal, antibacterial, hepatoprotective, CNS stimulant, febrifuge, expectorant, anti-allergic, antihistaminic, and respiratory stimulant. So now let us see the clinical indications. Clinical indications of Amritottaram Kashayam. They are Kasa, Tamakashvasa, Samanya Jwara, Taruna Jwara, bronchial asthma, chronic bronchitis. So this is the histology of lungs, alveoli. You can see the air spaces and the alveoli lined by the epithelial cells. Histology of lungs. You can see the bronchioles, alveoli. So bronchioles, they are lined by There, the wall is like made up of the epithelium, and then there are smooth muscles also there. So they are responsible for in asthma. They are responsible for they go for spasm, and there will be decrease in the lumen of the bronchioles, and there will be breathlessness. So bronchial histology, you can see the innermost lining is a pseudostratified columnar ciliated epithelium, and below it is the mucosa, and that contains smooth muscles, and then there will be adventitia and cartilage. So this is emphysema. X-ray test of PA of emphysema. You can see the following findings. There is increased intercostal space, and there is increased translucency of the lung parenchyma, then flattening of the hemidiaphragms, and teardrop heart, a vertical heart. You can see the bronchiectasis X-ray finding. So there is a prominence of the bronchovascular markings are prominent, and there will be beehive-like appearance in the lung parenchyma. The halar shadow is prominent. The pneumonitis, there is consolidation. You can see the arrow mark. There is consolidation. That is uniform white opacity confined to the lobe, and it is present in the left lower lobe, isn't it? So this is a deviated nasal septum. You can see the X-ray of the skull, anteroposterior. We can see the septum, which is deviated in the 5 figures, isn't it? So nasal polyp, you can see the arrow mark shows the polyp. Nasal polyp is also indicated in Amritottara kashayam. So other indications are acute bronchitis, rhinitis, viral fever, chikungunya, dengue fever, and viral hepatitis, and also alcoholic hepatitis, pratishyaya, venosa, deviated nasal septum, nasal polyps, urinary tract, upper respiratory tract infection, lower respiratory tract infection, and pneumonia. I mean, with the different disease-specific adjuvant, it can be given various type of disorders with good outcome. So Amayaka Prayaga. In Kasa, it can be given with the Sitapaladi Churna. In Tamakashasa, it is given with Somasava, Tribunakirasa, and Talisadi Churna. In bronchial asthma, it is given with Kanakasava, Inguleshwar Rasa, and Talisadi Churna. In chronic bronchitis, it is given with Vasakarishta and Sitapaladi Churna. In acute bronchitis, it is given with Runapahari Rasa and Mrityunjaya Rasa. In rhinitis, it is given with the Naradiya Lakshmi Vilasa Rasa. Rhinitis with the Naradiya Lakshmi Vilasa Rasa. In viral fever, given with the Mrityunjaya Rasa. In chikungunya, is given with Tribunakirti Rasa. In dengue fever, given with Kaisharavaguru and Mrityunjaya Rasa. In viral hepatitis, can be given with Aragavardin Rasa and Godanti Basma. In Pratishyaya, it can be given with Naradiya Lakshmi Vilasa and Naradiya Lakshmi Vilasa Rasa and Sitapaladi Churna. In Pinasa, given with the Mrityunjaya Rasa and Sitapaladi Churna. In deviated nasal septum, it is given with Mrityunjaya Rasa and Talisadi Churna. In nasal polyps, it can be given with the Raudra Rasa, Kanjanaragula, and Anutaila Nasya. In upper respiratory tract infection, it is given with Mukkutakadi Vati. In lower respiratory tract infections, it can be given the mixture of Abrakvasma, Punandura Rasa, and Sitapaladi Churna. In pneumonia, it can be with Mrityunjaya Rasa and proper antibiotic coverage. So that is very important. Our discussion. Amritottara kashaya is bitter in taste and usually given in disorders associated with fever and respiratory disorders. It contains guduchi, haritaki, and ardraka. Guduchi is Tiktarasayukta, Rasayana, hepatoprotective, hypoglycemic, Apapittahara, and best immunomodulator in action. Haritaki is Pancharasayukta, Rasayana, Virechana, and Malavatana in action. And Ardraka is Kapavatahara, Kotrasayukta, Depana, Pachana, antihistaminic, CNS stimulant, and Archinashaka and Chardinashaka in action. Amritottaram kashayam is given in Shwasa, Kasa, Tamakashwasa, Krimi, acute bronchitis, chronic bronchitis, bronchial asthma, viral hepatitis, alcoholic hepatitis, dengue fever, chikungunya, COVID-19 infection, etc. It can be prepared as Sandhaniya formulation by fermentation of the kashaya after mixing it with jaggery. Sandhaniya formulation can be preserved for longer time. Now coming to conclusion, Amritottaram kashayam is given in diseases associated with fever and respiratory disorders. It is given with vata kapha disorders or kapha disorders and respiratory infections. It is bitter in taste and difficult to administer in children. And there are least adverse drug reactions even after prolonged administration of this formulation. So, Amritottara kashaya is usually given in diseases associated with fever and in case of respiratory disorders. So, these are the references. So, thank you for patient hearing.